I Am a Nurse by Megan Geeson. What is the professional image of a nurse? Just like anything in life, what you think of yourself is ultimately how you will portray yourself to others. Positive self-concept and self-identity will help to develop a confident self-image. I read in a discussion paper how the self-images that nurses have for themselves often differ from that of the public. This may mean that the public doesn't fully understand what the nursing profession consists of, and the job description is falsely construed. The discussion paper addresses how the public image of nursing doesn't match their professional image. When nursing comes to the conversation, many think of images of being an angel, to a sexual stereotype, or to being inferior to the physician. These stereotypical images of nurses undermine the actual education, knowledge, character, and skill set needed to be in this profession. The media develops misconceptions of nursing, causing the image of nursing to be distorted, impacting how the public views nursing as a profession. Another article described that nurses can change how others view what our profession does, and can ultimately gain respect and resources from the public. This is something that can simply be spread by nurses by educating people in the community about the profession, which will help nursing prosper and save lives. My perception of the nursing image is probably biased because I am a nurse who works in the healthcare field. But I believe the image starts in the hands of those portraying it, the nurses. They are encouraged to believe in their profession and to have the power to make a difference. We are hard workers who require lifelong education, proper communication skills, and a compassionate persona who are challenged with ethical dilemmas, and we vow to keeping confidentiality, all while maintaining a professional attitude. Our empathy helps those get through their lowest times, and our tough skin helps us leave sad or emotional situations at the door at the end of a shift. Being a part of the nursing profession is a challenging but rewarding and humbling position. In nursing, we use a combination of knowledge, skills, common sense, and being caring all at the same time. For me, that was a challenge, to learn to incorporate all of those together when caring for the patient. Nurses are with the patient for their whole shift. They are the ones who know first if their patient's condition is worsening, treatment needs to be changed, if the patient is ready for discharge, or as soon as they code. Not until then will it be brought to the doctor's attention. So the nurse's role is huge, and we deserve for this, what we actually do every day, to be noticed by the public. The traits of a nurse are unique and important to their professional tasks that are performed day in and day out. It's these character traits that are overlooked by the public and misconstrue the image of the nursing profession. Aside from applying knowledge, maintaining specific skills, and having common sense, nurses have to communicate with many different team members and all of their patients and their patient families. This takes patience, respect, compassion, and intuition. Nurses can certainly strive to educate the public on the necessity to have all of these traits in the nursing profession, aside from nurturing and caring. Nurses always put themselves first, and despite how tired they may be at the end of a shift, keep pushing to deliver the best care possible to their multiple patients, while maintaining sharp attention to detail. All of the words on the picture in this slide only begin to describe the traits obtained by each and every nurse. So, a day in the life of a nurse. In nursing, no one shift will ever be the same as the other, just as no one patient will ever be the same as another, or respond the same to a treatment, or handle their sickness as well as the last one who is being treated. Nurses adapt to each day and apply their ability to take care of the patient and be alert enough to be constantly assessing and observing to watch for any change or decline in health statuses of their patient. Nurses are constantly on their feet, may not have the time to go to the bathroom, lunch break may have passed while they were saving a patient's life, have loads of information stored in their head before they are able to sit down and chart it, and may be the outlet for the stress of many. And at the end of all of this, their shift probably doesn't end right when the 12th hour is up. The day of a life as a nurse may only fully be appreciated by other nurses, others in the healthcare field, or perhaps by patients who are taken care of by healthcare providers. Nurses do more than care and nurture, administer medication, and follow doctor's orders. Nursing is a field of its own in the healthcare, and the healthcare field wouldn't be as functional without this profession. So nursing is one of those things you have to ask yourself, is it your passion? Nursing is not for everyone. Not everyone can be a nurse, just as not anyone can fulfill other professions like engineering, law, real estate, publishing. To find what you love is to be great at what you do. Along with the passion for the profession comes the education to get there, the ability to hold the skill set and apply knowledge to everyday practice, and to give every day your all while caring for your patients. I knew nursing was for me when I would leave my shift thinking of ways to do better the next day, or things I could do differently to help make a difference in my patient's life. Nurses who have the true passion for this profession should be the ones to educate the public on what it's really like to be a nurse to enhance our professional image. And so I'll end my presentation with this quote: "To do what nobody else will do, in a way that nobody else can do, in spite of all we go through, that is what it is to be a nurse." And here's my references. Thank you for listening.